Hi, everyone. I'm Kelly O'Horo, and this is Adaptable Behavior Explained. Hi, everybody. Thank you so much for showing up today on Adaptable Behavior Explained. I'm really excited to have our guest, who is a board-certified nurse practitioner. Her name is Jennifer Montjoy. She is just a marvel at the topic we're discussing today, and others have referred to her as a badass medicine woman, and I think she's very much earned that title. She brings to us a wealth of knowledge and warmth and education, and I'm so excited to talk about psychedelic-assisted psychotherapy today with Jennifer. So Jen, thanks so much for being here. Go ahead and introduce yourself.
Thank you, Kelly. Thank you for having me. I'm excited to be a part of the podcast today, to be a guest, and think the world of you as well. So thank you for the lovely, warm introduction.
Absolutely.
And just a little bit about my background. I am a board-certified psychiatric nurse practitioner. I have a PhD also in nursing and studied biobehavioral neuroscience here at the University of Arizona in Tucson, where my practice is based. And the focus of my dissertation, my research around that was psychedelic-assisted psychotherapy for treating post-traumatic stress. And the focus also was utilizing ketamine as the psychedelic. So this is my passion. I love the work that I'm doing, and it's a privilege to be able to work with folks on this level of intimacy, and it's been very meaningful.
That's awesome. Thank you so much. So my experience with treating trauma for many years now is that standard PTSD, whether it's a single event or multiple events that are traumatic in nature, can be more easily addressed with things like EMDR therapy or other somatic bottom-up therapeutic approaches. But what I've really experienced is that the developmental trauma that so many of our complex patients experience is just harder to get at. And we are so, we have to be so artful at getting access to people beneath their defense systems and beneath the mechanisms that they have so necessarily adapted to and have developed over time to survive their environments. But sometimes their defenses are just too much of a good thing. So I am really excited for you to give us so much more information about this topic. And I'm really glad to have you here. And we can hopefully shed some light on this topic for those who are interested in seeking out psychedelic-assisted therapy, namely ketamine-assisted psychotherapy. In this day and age, there's a lot of different things that are going on. So we're going to dig into that. So if you find this topic helpful or interesting, please make sure that you like or share it with someone who may find it useful. And of course, subscribe so that you don't miss further episodes. So Jen, let's just go ahead and dig in. Can you give us a bit of the lay of the land as it sits now related to psychedelic-assisted therapy in society?
Sure. The current state of psychedelic-assisted psychotherapy is really fluid. It's an emerging field, which is exciting. And it started back in the 1940s and 50s. And in 1970, the pause button was hit, so to speak, by the government in a couple of different ways. So that put the kibosh on research and this exciting emerging field that was happening then. So fast forward to mid 90s, late 90s, and Johns Hopkins University was able to get approval from the FDA because most psychedelics outside of ketamine are Schedule 1. So they're still considered illicit substances, which is why we were also not able to do academic research utilizing these medicines. So the field is emerging since, again, late 90s, early 2000s. And here we are in 2024. So that seems like a long time ago. However, with healthcare, mental health care, new modalities, there's a big lag from bench science and clinical research to translating into clinical practice. So again, the other piece with this is that there's a lot of different medicines being researched. However, regardless of the medicines, the approach psychedelic assisted psychotherapy, the principles and tenets are the same, whether it's with ketamine, psilocybin, LSD, again, in clinical research and bench science research. The only difference is the length of the sessions, because the different molecules, these different medicines, have different durations. So the experiences with ketamine, for example, typically that psychoactive experience is about 30 minutes up to 45, 50 minutes. And some of those principles that overlap with psychedelic assisted psychotherapy, some of those tenets that are really important with this work are preparation. So preparing our clients around the experience, around the logistics, around their support system and community, because there's still stigma, right, with these medicines.
If I can chime in there, it's so interesting that you bring that up, because I even personally had a lot of apprehension around this field and this, like you said, this emerging approach. I think that as Western culture, we tend to be want to slap a quick fix on. We want to cut corners. We want, we want to do what's fast and easy, but not necessarily what's effective or what's honoring to the healing experience. And I came to this topic with some apprehension. And then I was also part of the DARE, generation where it was always, drugs are bad and stay away from bad things and don't put bad things in your body. And yet we are over medicating with psychopharmacology, with, in my opinion, medications that are far more damaging, far more addictive, far less useful, because they kind of put a Band-Aid on a broken ankle, as opposed to help a person fully heal and come to their fullest, most whole self. And so can you describe for us a little bit about how you see ketamine working when it comes to this opportunity for full healing?
Certainly. And I think across the board with ketamine and other psychedelics, that in an optimal container, so with trust, so that psychotherapeutic alliance that you have with clients. I think that these medicines, including ketamine, are over time softening those defenses, right? We call it, right, internal family systems speak managers, these protective mechanisms, so that we actually have access to this inner innate wisdom that we are all born with. But throughout life and our hurts, relational wounds, these defenses get really rigid. So I think, I postulate with this that ketamine and other psychedelics, when people are in a safe, again, container, those managers, those defenses feel safe and okay, that the medicines are allowing access to that self, that higher self, again, that inner wisdom that's innate in each of us.
Right. I can say that how I met Jen is I went through her training, and as did 9 of us from Infinite Healing and Wellness, so that we could, show up in this space, in this field responsibly. And personally, I felt a little bit late to the game because I was cautious, conscientious, and I had heard so many things going on in, neighboring companies and other places that were doing ketamine-assisted psychotherapy or just ketamine infusion. And people are so desperate, they will do whatever they have to. And, I was kind of holding a stance that with EMDR therapy, we can get access. But I think that the reason that EMDR intensives have become so much more popular is because it takes us so much more time to get the defenses fatigued, for lack of a better word, or whatever is happening that we can't fully understand because we're on the outside, watching. But what I've experienced with EMDR therapy is that I can get in there, but sometimes it takes so long before things settle down or they fatigue, or so that I can kind of get behind those defenses to the vulnerability and the grief and the feelings that really need our full attention. Having this experience with you and this training was just life-changing, in that I love that the experiential aspect is part of it, and that us as practitioners are asked, of course, not required, but we all opted to participate in that experiential side of things. And I just don't think I could explain it as well had I not been through that series and been able to see the difference. And so it almost felt to me, and what I've seen with clients since I've been using this, since going through your training, is that they're willing, they're ready. Like you said, there's this safe container. We have the therapeutic agreement, the alignment, the attachment relationship is built, fortified and strong in our clinical therapeutic relationship. And they want to let me in. They want to be defenseless. They want to find their way to healing. And this seems to just bring that default mode of protection down so rapidly. And so I personally have had such amazing experience with my own growth going through this, but also I've gotten to see with clients just such a huge difference so quickly. So can you tell us a little bit about some of the different approaches that are out there? Because people really just don't know what they know. And I want to give them a good guide for how to make this decision with information so they can consent to treatment knowingly.
Yes, ideally be fully informed. And it's true, particularly with ketamine, there are so many iterations and ways in which this medicine is being offered and by different providers with different backgrounds. And because of that, there's confusion. And even semantically, like the verbiage around it is confusing to folks. And so with psychedelic assisted psychotherapy, utilizing ketamine, it can be administered in a number of different ways, including IV, which is the prevailing model for administering ketamine, not for ketamine-assisted psychotherapy. Most of us that are practicing psychedelic-assisted psychotherapy, again, utilizing ketamine, so we call it KAP, K-A-P, are administering sublingually, so compounded ketamine, sublingually or intramuscularly. And I think it's important for folks that are seeking services with this medicine, that are looking for help, to consider what they're being treated for and the backgrounds of the clinicians that are offering the medicine. So, for example, most of the IV infusion clinics have been owned and operated by physicians and/or other clinicians, nurse practitioners as well, who have backgrounds in anesthesiology, emergency medicine, et cetera, and they're treating patients or clients for mental health conditions. Interestingly, there's typically not any type of mental health care clinician involved collaboratively in these clinics. And so for me, that's something to consider as a consumer. If you're being treated for, let's say, treatment-resistant depression, you want to work with a specialist whose background is mental health care. I think that's pragmatic. Unfortunately, that's not been the prevailing, again, way in which ketamine has been offered. So I think in vetting, considering as a consumer and being informed, what are their backgrounds? Do they have specialized training? Perhaps they are an anesthesiologist or a CRNA. So like a nurse who is trained at graduate level to deliver anesthetic medicines. Do they have specialized training around ketamine? And they may have certifications or training. The specialized training is important. Do they leave folks alone? Are you in a room with other patients, other clients? With this work, as you mentioned, the relational piece with the therapist, with the person that's facilitating these experiences is so important. In a lot of these clinics, folks, because the backgrounds of the clinicians offering the services are not mental health care providers, they don't know what they don't know, right?
Exactly.
And so with attachment wounds, right, these early life traumas, the relational piece and having somebody present that you can trust and that you do trust is critical.
Yeah, I have to say that personally speaking, there are several of those ketamine IV clinics in operation nearby. And we have actually had them come to Infinite for basically that the experience was traumatic because they were left alone. They weren't prepped with the setting and proper support from a family member and what to expect for that day, and really further compromised their levels of trust in, medical people, or trust that people could have their back because they weren't warned about things. And like you said, they don't know what they don't know. And so we've had to do reprocessing with clients that have had those experiences because it was so scary or painful or they were alone. And we have just not had that same experience here when administering it this way that we learned with your training, because, there is such a tight therapeutic alliance. There's safety in the moment. Everything's with permission. We're sitting right next to them in whatever proximity they ask for. They are, it's so client centered. They get to be in charge, and we're just there journeying with them, and really able to transcribe everything that comes up that we can further integrate that they came up with in the continued therapeutic relationship. And I think that's the piece that's missing in a lot of these approaches is, let me go get my ketamine done, and I sit in my room, and there's nobody taking down the data that comes up, and then they don't necessarily know how to bring that information forward in an appropriate therapeutic way. So I do think that's an incredibly critical part of becoming informed about how it's being administered. And I think that there is a misnomer that because someone may be a doctor, they might be more equipped to do this kind of work. So I really appreciate you talking about if you're not trained in mental health, and more importantly, if you don't know the client well, there's a lot of opportunity to miss if you're not sitting there in that cadence and that space with them. So I really think it's important that people are looking for an approach where there is a mental health provider, perhaps even including your own mental health provider in the collaboration and the therapeutic experience for that. So I really appreciate that. So let's talk about some logistics. We talk about the resources, how it's administered, the scheduling, what's best practice for how many times someone must do this or to have the best outcomes. Can you talk a little bit about that?
Yes. So, some of the logistics with KAP, again, ketamine-assisted psychotherapy, it's important that folks have transportation lined up, no driving after receiving ketamine the day of. And in terms of, other logistics, the ideal, again, is that they're working with their therapist that knows their story, that really does, that knows their history. And it's challenging, again, when folks don't realize what they don't know and the importance of that, and that it could be doing harm. And so typically the sessions are 2.5 hours, depending, 2.5 hours. So it's a time intensive, but it's also short lived. And based on the data, we have big data, meta analyses of utilizing racemic ketamine for treating mental health care conditions, treatment resistant, primarily depression. 5 to 6 sessions within 3 weeks are what the data state is needed in terms of the best outcomes, the most robust improvement, and also for duration. So the length of improvement after that initial series of 5 to 6 sessions.
Yeah. So it's pretty time intensive for someone to commit to 2 to 3 times a week for 2 to 3 weeks to make sure you can get all 6 of your sessions in. But I have to say that has been the model here that we're encouraging. Like when you're ready to fully commit, we want to make sure you get the full experience. The outcomes are so much better in the research with that. And each experience builds on the one before. And so, and every experience is different. And I think that's the thing that you can't fully understand until you go through it, is don't have any expectations, because that's usually part of our desire to control things anyway, but just let the process unfold in the most organic, natural way that it can. And what needs to be addressed will be revealed. And it may not be what you hoped it was, but I think that it's data nonetheless. And it's important that we have that information clinically. As the therapist, I want to know what's next on our list of things we need to tackle to get you to your most optimal whole, integrated self. And so I really appreciate the 5 to 6 experiences in that short amount of time. So if I'm listening to this, how would I know if I'm a good candidate for ketamine assisted psychotherapy? Because it's definitely gotten a lot of buzz. How would I know if I'm a good candidate, and what things should I look for?
That's a great question. In terms of candidacy, most of the folks that seek ketamine assisted psychotherapy have exhausted traditional and available treatment options. Most of the folks that I've worked with over the years, some of whom have even gone through ECT, so electroconvulsive therapy, which is pretty extreme, intense. Sometimes, TMS as well, transcranial magnetic stimulation, of course, multiple medications, and typically are motivated. So also therapy, many of whom, and are often referred by colleagues in mental health care here in my community in Tucson. And so I think folks who are really feeling stuck, who are also motivated, as you said, it's a high resource treatment, even though it's within 2 to 3 weeks. But requires, it's a time consuming and resource, consuming approach. So I think for folks who, again, have exhausted, are feeling like they've tried everything and are stuck. Also clients who are maybe participating in EMDR or internal family systems, other modalities, and are becoming too activated. And again, that stuckness piece, right? They're not able to progress, or maybe they've plateaued with those modalities, tend to be good candidates.
Right. That's great to know. I am excited because there's some long-term clients that I've had who have chronic PTSD, who have put in so much effort. Some people I even see, once or twice a week, for 90 minutes or 2 hours. They are invested, and we are working. We are not messing around in here. And so I'm so excited that they now have an opportunity that can help them to accelerate this process, because they're working so hard. And I love that we have an opportunity to help them a little bit more expeditiously and help people come to us a more whole sense of self. And, I've seen it be really effective now with people that are really hyper aroused or hyper vigilant or really anxious and whatnot. And I've also seen it be so effective with people in a really hypo aroused state where they're blunted and it's hard to get access to affective arousal, and they're just flat and they feel, sort of laissez-faire about everything. They can't access super sad, but they also can't access joy and elation. And so they're just living in that gray area with the emotional human experience being so blunted. And so I love the opportunity for people to open up that full array of, the rainbow of emotions that are part of the human experience. It's so exciting for me to help people in this way now, like I said, expedite their work. So and I would also say that people who have had other mental health conditions, but and maybe they have the resources to do this, and maybe they haven't been at it for quite so long, but they just don't want to be at it for 5 years, 6 years, 7 years working on it. Would you recommend that some of these more complex people could start it a little bit earlier, or that they don't have to wait till they feel stuck or plateaued?
Yes, I think it's absolutely. I think that this can be helpful for many folks, at different points on their healing journey in different places. So I certainly, wouldn't negate working with folks or discouraging folks who are maybe, earlier, just starting in their healing journey. Ideally, they've at least trialed a couple of options, and part of that is operating just within our system, because it is off-label use,
right?
Utilizing ketamine.
So when you say a couple of other options, like they've tried other medications and they're not finding reprieve from their symptoms with other medications, so now a medical prescriber can justify this for use, is what you're saying?
That's right. That's the
Okay.
ideal. Yes.
Okay, great. So I want to go do this. How do I find a ketamine-assisted psychotherapist that meets some of the criteria we talked about in today's show?
Yes. So certainly a Google search is an option. I have a directory of clinicians, both psychotherapists and prescribers on my website, which is trippaz.org. And there's a directory tab. And so there's a list of clinicians who have gone through my 4-day training, predominantly in Arizona, but also across the U.S. So for folks tuning in from other places, or perhaps with extended family or friends that might benefit from KAP, there are clinicians on the directory as well that reside and are licensed in other states in the U.S.
Awesome. I really appreciate that. And you know, if they weren't trained by you, are there other trainings that you know are doing a decent job making sure that people understand the full package, the relationship, the set and setting, the attunement that's needed, the space, the logistics, the sound, you know? I mean, there are places that are doing this and maybe they have 4 of the 5 components, but there's freeway traffic right outside the window. You know, it's pretty frustrating. Do you have a list of questions or some things you might want to share with someone calling and trying to interview to find out if they're qualified in a way? So just in case they don't have someone that has been trained by you in their area?
We touched on it earlier in terms of psychedelic assisted psychotherapy. So ideally folks that have gone through special trainings or, you know, certification programs that are applying these principles around set and setting, the music, you know, having a witness of the space holder. And there are some very reputable other, you know, organizations that train. Certainly, you know, I trained with the Ketamine Training Center, which is based in the Bay Area in California. And, you know, they're a phenomenal group of mental health care clinicians. You know, in the Berkeley area, there is the KRIA Institute, and again, very seasoned mental health care clinicians, and they've trained a lot of folks, a lot of licensed providers as well. Prati is based in Colorado, and so clinicians that have trained through Prati, PRATI, I would also certainly trust their skill set based on the folks that are running that program. And then Polaris as well, which is also in the Bay Area, is another training.
And we'll go ahead and put a list of those in the description below for you guys to refer to later. I appreciate that. And, you know, just like all modalities, I think another important question to ask is, you know, do you do your own work? I think that's a fair question. If you have a therapist that says, that's too personal, or I don't know that that's an appropriate, you know, question to ask, I think that's a good sign. It's a good sign that says, you know what, if we're not practicing what we preach and we don't have some of our own personal experience in these areas, I think that it's a little bit of a disservice to a client. And of course, that's not a requirement, but I do think that it's just a good thing to keep in mind. You know, we really ought to be doing trainings that offer experiential sides of things. And a lot of trainings do offer that, because then we really know what we're asking of our clients. And we are so much better able to be attuned and compassionate and loving. And I think that's such a huge part that acts as a catalyst in this experience, because feeling felt, feeling seen, feeling held in ways that weren't necessarily true at the times of our traumas are really a major factor, I think, in the healing process.
Yes, I couldn't agree more, Kelly. I really couldn't. And to your point about people, you know, stuck in like the sympathetic nervous system responses, I think what's happening is we're calling, you know, this freeze or shutdown response, you know, treatment resistant depression, because there is overlap, and certainly they can co-occur, right? However, I think it's being mislabeled. And so, I think it's important that people do know firsthand what they're doing, and also that they're on their own healing journey, because many of us, as you know, called to this work, we're wounded healers.
For sure.
Right? What's important is that we are healing wounded healers, right? And I say healing intentionally, right? Because it's ongoing. And I agree. I
tell my clients we're not done because we're not dead. There is always work to be found and healing and growth to pursue. And we can do that in so many different ways. But this is really exciting to become part of our potential treatment regimen for the people that are ready to do the work, that have suffered from depression, anxiety, PTSD, chronic PTSD. And I love that that's the body of research you've added to the mix, because it's such a beautiful additional option for people.
It really is. And isn't it a privilege, Kelly, to be able to bear witness to this?
Yes, it really, truly is. And that quiet space of resonance that is afforded to us as providers is so powerful. I mean, I can even remember a few times that I've been doing this, and I'll have just this overwhelming sense to just like send love in a moment, because I don't know exactly what's happening if they're not currently reporting, and just having this overwhelming sense like love is what's needed right here and right now, and just allowing myself to just share that, not with touch, not with words, but just this resonance in holding this space. And I think it matters. It really matters.
I couldn't agree more.
Yeah.
It really, it's beautiful. And again, it's such a humbling experience as a provider.
So, well, Jen, is there anything else you'd like to add before we call it a day with this topic?
In terms of, if there are clinicians listening that are interested in training, I've just added some more dates again to the website. They can find those on the trippaz.org website. So I've added some training dates for the second half of 2024 this year. And
awesome.
Thank you so much, Kelly, for having me.
About the training experience with you. Truly a badass medicine woman and such a gifted teacher and practitioner. And I'm so grateful to have had you here today. I think that people deserve healing, and you are really a messenger of that healing, so that we can all become better treatment providers and do so conscientiously. So thank you again for your gifts and your willingness to be here with us today. I can't thank you enough. And I look forward to further conversations with you on this topic, this emerging topic, as other medicines become available and FDA approved. So thank you again, Jennifer Montjoy, for being here. We'll leave the links below and the resources that we've provided today. But until then, I hope that you all lead with love. It'll never steer you wrong.